Hello, good morning, everyone. This is nursing students, Tejumala Kende. Yes, this is a series in which I'm about to start, and here in this series, we talk about common disease conditions and what are those nursing interventions that can be done. We as nurses, we need to educate ourselves on common disease conditions and what are those interventions that can be done. We as nurses, we have our own interventions that is different from the medical interventions. That is, what are those things we ought to do when we see a patient with some disease conditions. But today, please, before we continue this video, please, you can follow my account so we can educate ourselves on what are those interventions that can be done. Yes, and probably you can drop questions. If you have any question, you can drop it down in the comment section. Today we'll talk about stroke. Yeah, it's a very common disease condition also. Let's start with stroke. Stroke, what do we mean by the word stroke? Stroke is talking about when there is a disruption in the blood vessels that carries blood to the brain. The vessels that carry blood to the brain, when there's a disruption in those blood vessels, it leads to brain damage, and automatically this leads to stroke. Now, we have two main types of stroke. We have the ischemic stroke and we have hemorrhagic stroke. Let's start from ischemic stroke. What do we mean by ischemic stroke? Ischemic stroke is talking about when there's a disruption in the blood vessels that carries blood to the brain, when there's a blockage leading to what we call the blood clot. So when there's a clotting there, so automatically there won't be enough blood supply to the brain, and this causes ischemic stroke. We're talking about hemorrhagic. We'll talk about the word hemorrhagic. This is from the word hemorrhage. So when there's a rupture in the blood vessels in the brain, when this disruption leads to the rupture of the blood vessels in the brain, leading to bleeding in the brain. So that is hemorrhagic stroke. So I think we get difference between ischemic stroke and hemorrhagic stroke. So now we move to those interventions. We as nurses, what are those first line of intervention? For a patient with stroke, what are those interventions that can be done? What are those things that we can do for a patient with stroke? Number one is initial assessment. We as nurses, one line of action is to assess the patient. We need to assess the patient before we do anything, before we administer medication, before we do anything. We need to assess the severity of the condition. And in this assessment, what do? In initial assessment, we perform a test, which I abbreviate as FAST, F-A-S-T. F-A-S-T. The F there, we look for face dropping in the patient. That F there, we look for face dropping in the patient. That is, the muscles in the face, the facial muscles, because becoming weak. So leading to the face dropping. Face dropping. That is number one test. Another one, the A there stands for arm weakness. Arm weakness. This, you tell the patient to maybe raise his or her hand and see if the patient can be able to lift his or her hand. And we do that type of test for the patient. The S there it signifies speech difficulty. Speech difficulty. A patient with stroke will have difficulty in speaking. So we ask the patient to be able to talk. If you see the patient can talk, you see that there is a slur in the speech. These are under sign that can tell you that this patient has stroke. Another thing, the T there is time to call for emergency. So we have FAST. Don't forget I said the F there stands for the face dropping, the A stands for arm weakness, the S stands for speech difficulty, the T stands for time to call for emergency. Come for emergency after you've done your assessment. Another thing is monitoring. In this scenario, the patient's vital signs are very, very important. A patient with stroke, we need to perform what we call GCS, that is Glasgow Coma Scale. I don't know if I pronounce that right, but Glasgow Coma Scale, GCS. It is a neurological test that is done for a patient, like especially with stroke or a patient that is unconscious. We do GCS for the patient. We are going to talk about this GCS in our next series. I'm going to explain in depth of it, or we can read more on it. GCS, Glasgow Coma Scale. Some of us have heard of it. So this is a test in which we assess the level of consciousness in the patient. We assess the level of consciousness in the patient. That is under monitor, and we also mention the blood pressure, all vital signs, blood pressure, the temperature, the respiration of the patient. These are very, very important in a patient with stroke. Another thing is medications. But before we go to medications, let's talk about post-stroke care. That is after after the patient has been attended to and the likes. What are those care we give to the patients after discharged from the hospital? Like rehabilitation, telling the patient to perform exercise. You can tell the patient some exercise that can be done in which to be able to come back to his normal self. So those are some of the post-stroke care. Now, under medications, now there are some drugs in which that can be administered to patients with stroke. Please, this drug should be prescribed by the doctor. The drug should be prescribed by the doctor and used accordingly. But this is just giving us an insight or knowledge of what are those drugs that a patient with stroke can use. One is we have some group of drug, we call them anticoagulant drugs. These anticoagulant drugs, this helps to stop, it helps to it helps in breaking the blood clots in the vessels. Don't forget I talked about under ischemic stroke. I talked about when there is a clot in the blood, so it helps to disrupt the movement of blood to the brain. That is, it causes clot in the blood vessels. So what this drug does is that it helps to break down those clots. That is, preventing blood clot formation. And there are some drugs under them. We have the warfarin. Warfarin is an example of it's a good anticoagulant. We have heparin also. Heparin is a good anticoagulant also. Also, we have some medication. We have some antiplatelet drug also. What is this antiplatelet drug? You should know that a patient that's experiencing difficulty in clotting of blood, we need some antiplatelet drugs that can help in clotting, that is to prevent clot formation. When there is a blockage in the blood vessels, we need some drugs that can prevent formation of clotting of blood, and those drugs we call them antiplatelets. From the word platelet helps in blood clotting formation. So antiplatelets, that is against preventing blood clot formation, to prevent the blood from clotting. We have some drugs under antiplatelet. We have clopidogrel. Clopidogrel is an antiplatelet drug. We can read on it. Clopidogrel or Drugel. Yeah, clopidogrel. I think that is the right pronunciation. This drug is an antiplatelet drug. We also have aspirin. Aspirin is also is an antiplatelet drug also. All this helps in preventing blood clot formation. These are just examples of the drugs that are used under antiplatelet. And for anticoagulants, we have warfarin, we have heparin. All those are anticoagulant drugs. So stroke in general is just talking about prevention of we are trying to prevent blood from clotting, that is blocking the blood vessels. All right. Also, we need some antihypertensive medication. Don't forget, a patient with stroke will have high blood pressure, so we need some medications that can help control high blood pressure. We have some medications that can be used. We have the beta blockers medication. We have the calcium channel blockers. Like under beta blockers, we have the labetalol, we have propranolol and the likes. But under calcium channel, we have nifedipine, amlodipine. We'll talk about all those when we come to the series on drugs. We'll talk about that. So all these are some of the interventions that can be done for a patient with stroke. So I hope this helps a little bit. And if you have any questions or you have any contribution, you can drop it down in the comment section. Bye for now.